A picture of young girl and her grandmother are shown on screen.
My grandmother, sometimes I would rub her shoulders and her back and her feet. She looked at me and she says, you would make a good nursing aide someday, or a nurse. When you have that compassion to do this, then you're in the right place.
Caregivers are shown working with the elderly, performing several tasks, including taking blood pressure, assisting in and out of bed, feeding meals, and washing hands.
Nursing assistants care for the elderly by feeding, bathing, grooming, and dressing them. Multiple times a day, they move patients between their bed, wheelchair, bathroom, and other daily activities. Regularly, they're forced to take heavy patient loads and frequently work double shifts to cover missing staff. Sprains and strains are all too common among this workforce. These injuries are often debilitating, painful, and ongoing. Ironically, this forces many to leave an occupation caring for others to seek care themselves.
A caregiver is shown, slowly moving a device for lifting and transporting patients and heavy medical equipment. Text on screen, The Caretaker Crisis Investigating Work-Related Injuries in Healthcare.
Well, I was working at Detroit General Hospital. They didn't have beds that went up and down, and 3 of us were trying to move a 280-pound patient from the bed to the wheelchair.
Barbara Silverstein, PhD, MPH, CPE, and former research director of the SHARP program, and also a caregiver, is shown telling her story in a former nursing home, alongside a picture of her as a younger caregiver. An X-ray is shown on screen of separated spinal discs in her back.
And so we're struggling. The other 2 couldn't hold on and let go, and I ended up underneath him. That splattered a vertebrae. I was in rehab for a while, and it was really clear that I could never go back to acute care nursing.
Text on screen, Dr. Silverstein went on to pioneer research on the causes of work-related sprains and strains. Sabrina Duncan, a certified nursing assistant, is on her couch at home. Hands are shown moving a wheelchair as she tells her story.
So I was going to go in and help the resident, but when I got in there, he was not properly hooked up like he was supposed to be, because he was an amputee of the right leg. The patient had Alzheimer's. He would come in and out of it. I said, okay, I need you to put your arms around my hips. I'm going to stand you up. And next thing I know, as I was turning him to pivot on his good leg, he brought that leg up. When he pulled me down, it overstressed the back, which pulled me almost to the ground.
Text on screen, after 23 years and 6 injuries on the job, Sabrina cannot go back to work at age 50.
Sabrina tells, her story is really sort of gets you in the gut, but it is extremely common.
Text on screen, in Washington State, about 10 nursing assistants are injured every day.
This is a tough job because your body is not meant to be torn up like this. You try everything you can to compensate yourself, but you're never the same. I'm never going to be the same, ever.
Dr. Silverstein and a team are discussing their project in a medical lab using computer modeling technology.
Dr. Silverstein and the SHARP program believe a systems approach can best tackle this epidemic. The systems approach looks beyond individual actions and instead studies the entire system in which workers operate.
So if you think about a box and have the corners connecting diagonally, and you put a person right in the middle of it. Okay, at one corner you've got technology, the other corner you have organization, environment, and then the fourth corner, the tasks. If any of those connections are broken, you have a massive increase in the probability of injury or some other thing that you did not want to happen. We need more sort of stories out there about what are the other components of what's going on besides what the actual injured worker does or doesn't do. I actually think that would help employers a lot too, in terms of really looking at the systems approach. It could improve productivity, it could improve quality, and it could improve life.
With the aging baby boomer generation, the need for nursing home care is quickly increasing.
Footsteps on a busy street appear, along with a graph showing a strong projected increase in percentage of Washington population aged 65 and over.
Over the next 15 years, Washington State's elderly population will see a 50% increase in size. More workers will be needed to care for this aging demographic. If left unchecked, worker injuries will expand with this trend, and the cost to healthcare services and to workers' lives may become unmanageable.
A browser is shown of a newsletter from SHARP, Safety and Health Assessment and Research for Prevention.
Find out more about what SHARP is discovering by visiting their webpage and signing up for their newsletter at lni.wa.gov/SHARP.
Washington State Department of Labor and Industries logo appears on screen.